The first presentation, which is going to be today, is going to be talking about choosing wisely Africa in general. I'll be introducing Choosing Wisely to all the participants in this conference. And Choosing Wisely initiative in general started in high-income countries with the United States of America, Canada, and India. And we looked at all these publications and initiatives, and we said we probably should have also Choosing Wisely Africa, because we felt like it's where it's actually very meaningful because of, as I said earlier, little resources that we have. So we published our first paper in 2020, listing 10 practices that we felt as a community. And the community, I mean oncologists, patients, advocates, policymakers. And we said these are the first 10 practices that we feel are not, should not be practiced on the continent. And we published that paper in 2020. And then we followed up also to validate the list by publishing another paper looking at what the frontline oncologists think about the list, which was a way of validating the list. And so what I'll be sharing with the participant is the reason that we should move this initiative to a wider, I would say, to all the African oncologists. And saying that, whenever you're thinking of asking a test for a patient or prescribing a medication or doing an intervention, think about whether what you're doing is, one, evidence-based, two, whether it's not going to harm the patient in terms of the side effect, but also you have to think about the financial aspect of what you're doing for the patient. And also, of course, involving the patient in the discussion and taking decision should be a shared decision-making practice on the continent. So that's what I'm going to be sharing with the participant for that particular talk. Choosing Wisely events are here to raise awareness of value in cancer care, I would say, in general, but now that is happening on the African continent for the second time, as we are here in Tanzania, it raises awareness of resource utilization on a continent where we have low resources for cancer care in general. So when we have such events, we are with several oncologists who are the major stakeholders in cancer care. And what we are telling them is to utilize resources, the little resources that we have, in a very good way that doesn't affect patients in terms of a very financial toxicity. Here we mean utilizing unnecessary interventions or doing a lot of tests that are not necessary. So what we're asking clinicians or oncologists in particular is to make sure that they are very good stewards of the little resources that we have on the continent. So such events are good to raise awareness and to involve all the stakeholders that are involved in cancer care on the continent.